Welcome, everybody. Pleasure to be in your lives right now, and in your offices, in your homes. We're here today to talk about a new program we're working with Mercy College on, medical assisting. My colleagues, Tim Pearson from Mercy College, is the director of the program, and Dr. Roche is our senior VP, and will be part of the panel today. So we'll get started. Here we are. So, as many of you know, healthcare in general is suffering from tremendous workforce issues and challenges. One of those is medical assisting. I did a quick Indeed search, and just in one city alone, there were over 600 open positions for medical assistants. Mercy College is located in Des Moines, Iowa, and in that market alone, there are always like 60 to 70 open positions. Turnover with medical assistants is also higher. I mean, than normal. We hear about nursing turnover, physician turnover, but in fact, if you look at the data, medical assisting turnover is even higher. One study that was conducted recently with a large system showed it within a short period of time, there was like a 59% turnover rate. And when you think about what that costs the system as far as having to market, find people to recruit, train them, hire them, it can cost for every CMA that leaves over $14,000. And so this is a tremendous burden on systems right now. Dignity Health Global Education works very closely with Mercy College, and we were hearing from a variety of our health systems that CMAs were a significant issue. And so we worked to come up with a solution that gives the employers and the employees both flexibility and accessibility. And we think it's a very reasonable solution. Part of the solution, you have to think, holistically. It's not just about finding new talent. A lot of systems work with local community colleges and try to get new CMAs in, and that really hasn't been able to fill the need at all. And you also want to think about your own workforce, right? We want to be able to retain good employees, and an important aspect of any happy employee is to see a pathway for progression. If you want to stay in a system and you want to have loyalty and allegiance, you want to see where you can go in that system, right? So the program and the opportunities we've provided, we think will fit the bill for that. The program we designed is meant for working adults. It doesn't require folks to quit their jobs. It allows them to continue with what they're doing. A lot of the issue with community colleges is they require students that really quit their jobs, and it just doesn't work, right? Again, this is designed for working adults, so it's very flexible. All the didactic material is online. Students can access it at their convenience, after work, on weekends, whatever. We do have 2 6-hour skills boot camps, and that's to ensure that our students are ready for the next step. These are designed to be conducted on a weekend, generally on a Saturday. We do those in proximity to where the health system is, so students don't have to travel far for that. But it's really to do a checkout for the students, make sure they are ready to go to the next step. They have the manual dexterity. The cost for this is reasonable at $10,000. This is a fully accredited program by CAHAP, and it is probably the most aggressive for how much of the content is online. And we do that for a very important reason. It's so that students don't have to travel to class. They don't have to stop what they're doing to go to class. Because this is a clinical specialty, there is practicum experience at the end, which is 160 hours. Again, this is all accredited. Students will be able to sit for the certification exam when we're done with the program. So as an organization, you have current employees that you want to keep. It might be in environmental services, might be receptionist, might be phlebotomist. They're wonderful employees. They love working with you. Their mission is aligned with what you do. You want to give them opportunities to grow. So some of our healthcare partners are finding these employees and offering them the opportunity to get the CMA training while they continue to work. So they get to keep their salaries, they get to keep their benefits. The whole time they're in school, they're accruing the time with the organization, and they're learning new skills, right? So, and we actually provide a whole sort of skills list as the students go through the program. The employer can say, oh, well, now they could do this or they could do that, and start to pull those employees into this new role. So it takes a year to complete the program. And if the employer is paying for it, they ask for time commitment back. And generally that's been 2 years. And so total, you would have a 3-year commitment with that employee as they go through the program, and then stay to sort of pay back their commitment. All of the employees so far have required that they get their certification within the first year after they graduate, to have a fully certified CMA.
Julie, can I jump in real quick and just add
Absolutely.
on something that you were saying? Perfect. So, and you're doing a great job, by the way. Thank you. So there are really 3 pathways through which these new individuals can become a part of this program. And one, and you mentioned 2 of them, and one is upskilling existing employees. They are working in whatever role they are in the institution at this point. And we're looking to give them a pathway for success, as you said, and they seem like great candidates to become MAs. And so we keep them they can keep them in that position while they undergo their MA training and education until they become a fully skilled MA at the end of a year. The second is to hire somebody into a front office position. And as you mentioned, at that point, that individual doesn't have the training yet as they started their educational process and journey. But as that year continues, as they learn more and more skills, as they go through the boot camps, they will start to do what we call working into the back of the clinic. They start doing all the other things that they start becoming proficient at. And it's not just the front desk, not the front of the office, but it's the entire clinic. And that's a wonderful path. And the third is actually hiring individuals into other roles, because partners quite frequently have many more MA openings than they will, say, front desk openings. But boy, they need to hire somebody into a support position, whatever that support position is. And we find somebody who is a great potential MA student, but we hire them into something not necessarily MA, just like we upskilled that existing employee, and they're in that role while they undergo their MA education training. So there's a number of different ways that these individuals can become ready to go and ready to become a productive MA for that clinic or facility.
A very good point. A lot of systems use a multi-pronged approach because there are such needs. So they're upskilling current employees, but they're actually looking for new talent too. And so what one system did, Mercy One, was created this position called student medical assistant. And again, that could be receptionist, it could be patient transport, any position that you need to fill. Doing their training, they're fulfilling that work role. They're starting to accrue time with the system. And again, they're starting to learn the system. So when they graduate, they're ready to go day one. They know the system, they know where things are. I mean, I'm sure you've walked into a new place, especially a big hospital system, and it's just like, I don't know where anything is. Where's the ladies' room? And where's the and so you think about it, they're spending this time there. And so they really truly are already adapted to the system and being productive before they even get through the program. And again, systems are paying for these student medical assistants to get their education. They generally will come in at a pay scale lower than a CMA, which makes sense. It's incentive to complete and get your certification. And again, it's they require a 2-year commitment after. So you've got the upskilling of great employees. You want to keep them, give them that career path, and then you've got a way to recruit new blood into your system, and hopefully they'll stick with you as well. And a lot of the sort of the work turnover data show that if you can get somebody to stick with you 2 to 3 years, your chances of keeping them longer are much greater.
Boy, that 2-year commitment, Julie and Jeff, is so important on both sides, because when you're a student, I have a landing place when I get done. This is a security blanket that is wonderful for me, but for the partner, for the facility as well. When you talked about that massive turnover and the costs it takes and the time and the effort to replace employees, well, let's turn that into promotion. That right, and having that also a security blanket, that I've got this person here who will be a wonderful employee for 2 years, and as you mentioned, maybe stick around for longer once they've been there for 2 years. And so it really is win-win on both sides of the ledger.
Well, Tim.
Go ahead, Jeff.
Tim, it's an interesting point you bring up. So I want to make sure we do say happy MA week, especially to all those that are out there working already as a medical assistant and as a certified medical assistant. We don't want to forget that. But, I will tell you, as a former hospital administrator, what I appreciated the most about medical assistants was that A, they're your first touch point with patients, and B, oftentimes they were running the practice. They were running the show. While the doctor or the manager may be thinking they are, it is really the medical assistants who know the patients by first name. They know what's needed for the patients. And let's not remember, here we sit in October, flu shot month. They're the ones giving the flu shots. Last night, had 2 incredible medical assistants giving our 3 boys flu shots. The care, the compassion that they demonstrate. And what I love most about medical assistants is that this is such an awesome opportunity for them to stay in healthcare forever. So I'll give you an example. I had a medical assistant that I first was introduced to as an intern in my department back in my days as a director. She ended up working, to Julie's point, as an intern first, as a student. She then got a job in an entry-level non-clinical role. She then ended up getting to be a medical assistant through a community college program. And she then ended up working, in a practice, and then was identified by a leader who she saw when I first introduced her to as an intern, and was then hired as a practice manager at a very young age. And why was she hired? Because she was a superb medical assistant who was always hungry to learn, address the patient's needs, and to your point, was recognized for promotion. And we didn't go outside. We didn't even do the normal hiring process. That leader saw her, knew what she was capable of, and she came in as an intern, but frankly, more importantly, as a medical assistant. And so that idea of what medical assistants offer to our healthcare community can be often forgotten, and we must never forget what they do. And I think COVID has further shown how important they are to the whole system.
And to your point, Jeff, isn't it amazing when we talk about how important the role of MAs and the value they bring into a practice? But then on the other side, we say, look how we don't have any MAs. Look at the shortage of MAs and how that is affecting how a practice gets run, how effective healthcare is being delivered, satisfaction from the patient perspective. We just need more MAs. We need to get them educated. We need to get them into the system. We need to do it quickly.
And what happens when you don't have enough MAs, right? You're pulling the nurses to do some of that work. Nurses who are already stretched to the maximum. Systems have said we've had to cancel procedures and services because we didn't have enough MAs, and it's just the snowball effect. And really, by having an adequate, talented, well-trained workforce of MAs, it's going to help your nursing workforce as well. It helps the whole system, decreasing burnout. People are able to share a lot of this front end stuff. They are an absolute critical part of any patient experience and any high quality service. So
You're right. And I'll just throw one last thing in there. When you talk about it's a snowball effect, ultimately what it affects is the patient. And all of us are in healthcare for one reason, to help the patient. This is a helping profession. And anything that impedes that keeps that from happening at the level we want it to happen, boy, we got to figure out ways to change that. And this is one way we can from the ground up.
Yeah. So when we work with health systems, we're happy to co-brand. This is an example of what we did with a group in Lexington, Kentucky. Again, they had a huge need for medical assistance, and we're working collaboratively with them. All the students do their boot camps and their 160 hours of preceptor mentorship in Lexington. They don't have to go to Des Moines for anything. We work very collaboratively with our partners in the healthcare system. And they just accepted their first class and are thrilled. And most of I think just about all of the students were internal folks that they really identified as being people with potential and people that they wanted to keep in their system. So we can easily co-brand with you. And, one of the things about Mercy College, which is really, really positive, is they're associated with Mercy One Hospital. So they have a lot of dialogue between the college and the hospital about needs. But Mercy College is very dedicated to student success. They're one of the few places that have a student coach from day one. And so, again, some of these students might not have been in school for a while. And so these coaches are very important. How do you manage your time? How do you balance work, maybe family, and studying? So the coaches have been a huge value added from Mercy College. They work, again, from day one. A student can call them, ping them anytime. And I think that's a very important aspect for student success, right? A lot of these folks haven't been to school for a while. Some of them might have credits they might have started an associate program or whatever, it didn't work out. And so it's great to have a resource like that. And I think that's a big reason why Mercy College has very high retention and success. So again, we're here in education for the learner. We're here in healthcare for the patient. If that learner doesn't get through and learn these skills and get certified, it's not going to help the patients or the system. And so we are very learner focused in this program. Again, students that are struggling for money are distracted students. The fact that they don't have to quit their jobs, that they can continue to make money, they continue to have their benefits, is huge for student success. Not many programs guarantee you a job when you graduate. So, I finished my job, now I have to start a job search. We take that away. You're in the system, they love you already, they've already invested in you, they've told you you're valued. You've got a job when you're done. Many students, as I said, have started some work in associate degree. If they've got a certain number of credits and the right kind of background, we can easily transition them with this MA program to complete their associate's degree. And most systems, if you're working on a degree, you are eligible for tuition benefits. So again, very student focused. If the students don't succeed, we don't succeed. The program's a failure. And so this was all designed to make the student have the best chances of succeeding.
Julie,
So
and I think we can't remind everyone enough about the pathway, component here, because we have to be honest around the perspective that we know is true in healthcare, that to your point earlier about environmental services, or if you're a dietary aide, or if you work in some aspect within our healthcare system, other integral roles, but you're looking for that pathway that ultimately you want to go clinical, but you're not certain what that right pathway is, well, certified medical assistant is the right one to think about. And if you're a healthcare system, what's more awesome than anything about this opportunity is that you can literally be doing that job and still take on this opportunity, have health system support for, through tuition reimbursement, get to do your clinicals in the same exact healthcare system that you're already at, and then get to stay there where you've continued to have an impact through the work in dietary. And so, for me, I look at this as the perfect ingredients to a recipe that fulfills what healthcare needs. So we don't lose them to Sheets and other retail places, which oftentimes is what's occurring.
Amazon.
Amazon and other places. We must think more holistically around how we can keep them in healthcare and realize that many medical assistants go on to not only be nurses, LPNs, but also at times leaders, CNOs, and other roles in healthcare. And then some, do incredible work as a medical assistant for the whole time of their career. And because of them, lives are saved. And because of them, vaccinations are given. And I mean, talk about our vaccinations that we've seen in this year alone. Most of them have been given by medical assistants. Every year they're given by medical assistants. And so, we've got to be reminding our whole community and healthcare that this is a solution specifically customized, developed by Mercy and DHGE for them and for you. Not in any way, and that's where we stand out, where others have developed this just for quote unquote a student, but they haven't actually thought through what's required for a student to be successful. And what I also want to add is that I think what's awesome about how this has been developed, and I applaud Mercy and Julie and others that have influenced this process, is that it's also been developed with that trajectory in mind from the beginning. And so if you look at the online approach, if you come in and do this program and you do want to continue to be educated and trained, you will see that it's been developed with that from the beginning. And so you're not going to come in and just think this is any program. And then if you do another program in the future, it's going to look different. This is going to be very, very similar. And so it's truly developed for that learner. And so we can keep them in healthcare doing what they do best, which is serving our patients.
Yeah, thanks for that, Joe. There's a couple questions here. One of the places where health systems have looked to recruit externally are people who were trained as contact tracers, because a lot of them are no longer needed. Hopefully we're not going to need them much in the future, but they already have some comfort with talking to patients about health things. Some of them are, now looking for positions. So that is a good source to go looking. If you're interested in talking about how a health system would partner with us, we will put a contact in the chat box, but we're happy to start a conversation. Again, we do 2 starts a year, April and October, and it's a year-long program. Somebody asked, is this one of the only programs that's currently delivered online and part-time? There are a couple others that are sort of organizations that aren't credit-bearing, degree granting. One of the awesome things about working with Mercy College is if a student already has some college credits, we could work with them to design a way to get them that associate's degree. Again, thinking about long-term advancement, progression, personal development, professional development. One of the things that Kentucky did, which I thought was very clever, for units that sent people into the program, because the last quarter students are doing their 160 hours of preceptor time, they allow those units to go ahead and hire somebody during that last quarter. But the reality that student isn't going back to their old job. They're going to do their 160 hours, they're going to complete the program, and they're going to become an MA. So you've got an opening. So that system said, hey, we're thrilled that you sent an employee to us. We're going to let you hire that last quarter while the student's in. So I guess we can put in the chat how how we can, if you want to talk about this, you can reach out to me directly. I'm putting my email in here. So feel free to ping me and we can start the conversation. We have a lot more collateral we could provide you. We didn't want to get too far into the weeds, but we really want to present this concept of this is a solution to a significant problem that's not going away anytime soon. And we are all committed to supporting the workforce. And so if we can help you meet your needs in any way, we would love to talk to you. Tim, do
Julie,
you
the
have
other
a
thing I
Tim,
just want to make sure
okay.
people understand too, is that recognizing how busy healthcare professionals are, this program also has 24/7 support. So, as you work through it and you think of, inevitably how healthcare is, doesn't matter what role you're in, it's busy. You could be doing this course later in the evening. Some people like to learn later, some people like to learn earlier, but you still have support. And you have, to Julie's point, in many ways, like a personal concierge with the support of Mercy that's going to be there to help you. And so I think it's really important that people understand that support system that is in place. And to your point, Julie, the support system that's in place for healthcare systems. And so, the DHGE and the Mercy team have put together a phenomenal toolkit that literally for a healthcare system walks through how we could work together to fulfill and truly make this a turnkey solution to what truly in many ways is a crisis in our healthcare workforce when we look at allied health, but particularly medical assistance. When you look at 600 positions open in one region alone, that's inevitably going to impact our system. And while earlier we talked about the nurses, let's not remember the impact that also has on our doctors and our nurse practitioners and our physician assistants, because who do they turn to when they need help with Epic or the electronic medical record? They often turn to a medical assistant. And so, everyone is impacted by this. And as Tim said earlier, it all goes back to the patient. And so we've got to be flexible, nimble, and solution-oriented to address this. And that's what Mercy and DHG have done. So you just reach out, we'll find a solution for you, and we'll make it work for you and your system, and keep the patient in mind throughout that process.
And, Jeffrey, that's exactly what I was going to say, and to your point then, Julie, as well. There are a lot of voices in the room here, and we want to partner with you. We have this is something that is, it's like a ball hit right down the middle of the fairway. It just works for everybody. And so reaching out to Julie, to Jeff, to me, to anybody here, and we can start a dialogue, start a conversation, see what your needs are, and see how we can get those needs met. And we're ready to do that. We're excited about the prospect.
And to build on that, Tim, this is about a partnership. It's very important for us when we work with partners, especially that are distance from us, that you have commitment to this as well, that you've got somebody on site that the students can meet with, that you start building the culture and the ethos of your organization with these students, especially the ones who are new to the system that you're recruiting. And again, we support you, we work with you, but it is a collaboration, it's a partnership, and our focus is on that student who's going to become a very important part of that healthcare team. So if there are no further questions, thank you all again for joining us. Tim, Jeffrey, thank you for joining me on this. Would love to talk to anyone who's interested, and certainly send us questions, get in touch with us. We'd love to work together.
Yep, and happy MA week to all those that are out there on the front lines of our healthcare system. Thank you for what you do, and we never can say thank you enough, so thank you.
Thank you, CMAs. Happy week.